The great thing about one-payer states is we can talk about policy from here till the end of time. And we tend to fall short. I mean this as a self-critique on what it is that we can do politically to win. And our primary, as you all know, I think everybody here knows, our primary legislative task is to get the State-Based Universal Healthcare Act passed. When I say primary, because one-payer states, this is our primary focus. We support national single payer. We jump in when that fight's happening. We jump in to stop the privatization of Medicare. So we operate on multiple tracks, but nobody else is concentrating an effort on getting passage of the State-Based Universal Healthcare Act, which provides the enabling legislation, the super waivers for states to bring in the federal healthcare dollars. 50 to 70% of the total amount of money in healthcare is spent at the federal level. We need to bring those back to states that are modeling universal healthcare single payer systems. And so we really have got to get this legislation passed. And I'm just going to spend just a couple minutes here, very briefly. I'm dropping the text for the bill that just was reintroduced, HR 6270, Khanna's bill. And Mike, if you have other resources like One Click Politics, anything else, drop that in the chat. But we've really, I think folks know that I moved to Washington, D.C. on September 1st, intent to spend whatever time it's going to take the next 2 to 3 years to get this legislation to pass. The reality, the political reality in Washington is that we're not on the radar screen yet. You know, SBUHCA, State-Based Universal Healthcare Act, it's a blank spot for people. They're not aware that it even exists for the most part. And a lot of legislators will sign on because they're told, well, this is the thing to do because you're part of the Congressional Progressive Caucus, the CPC, or, you know, I like this legislator, this member, I'm going to be supportive of them and so forth. But actually understanding what this legislation does is our critical task. We need to educate, we need to lobby and get people to understand that in order to address the questions that Steve's talking about and that Dana was talking about earlier, the value-based payment problems, as well as pharmaceuticals, as well as all other aspects of healthcare problems that we have in this country, we've got to get this legislation passed. So the way we get it done is take a look at what is half of the Democratic caucus, right? Half the Democratic caucus signs on with Pramila Jayapal's Medicare for All bill, and 17% sign on with Bernie's Medicare for All bill every 2 years. But we're stuck. It's a ceiling. We're not going to win right now on national Medicare for All single payer. But we can do this with SBUHCA. And the reason we can do this is we bring together that quarter of the Congress, about 118, 120 members, half the Democratic caucus, add to that those members that support the public option, which is another 15, 20% of the entire Congress, another huge chunk of the Democratic caucus. And then there's another segment of the Democratic caucus that focus almost exclusively on expanding Medicaid. And that captures most of the Black caucus who live in red states, southern states. So you've got folks who support single payer, those who support the public option, those who want to expand Medicaid, and then there are swing state Republicans who need to demonstrate that they have to show that they're serious about doing something to address the health inequities, the rural hospitals closing, all the other problems that have been described today and defined in other forums. We can cobble together 218 votes, in other words, if we're smart, if we're strategic, if we're targeting our messages in a way that gets them thinking they've got a seat at the table, right? It's not my job here in Washington, D.C. to argue why single payer over the public option. That's not my job. My job is to convince people who support the public option that you have the opportunity to model the public option in one or more states as we model single payer in other states. It's the only way politically this is going to get done. And also to convince folks that Medicaid expansion, the only way to get to Medicaid expansion is to create universal healthcare systems. Ideally, of course, single payer guaranteed healthcare for all. So that's my challenge here in Washington, D.C. is to be a channel back to you all to get you all understanding that we've got to be smart in how we communicate and how we target and how we frame these discussions with our members of Congress. We just picked up Chelly Pingree overnight. We're now at 27 co-sponsors of SBUHCA. But what's really interesting is that we picked up center-right Democrats, Dean Phillips in Minnesota and Adam Schiff in California. which means that our messaging is starting to crack. It's starting to get through. Those are the folks we need to get on board with the State-Based Universal Healthcare Act in the House. And then Steve has already pledged, right, Steve? You've pledged to bring one of your two Hawaii senators into, or we're going to work on it, right? Get one of the two senators in Hawaii to run a companion bill in the Senate, where the Democrats do have a majority right now. If we get that done quickly, we can begin having hearings. And that's really important for advancing our public education. I'm just coming off a meeting with Charlie Swanson and Wendell Potter. We met with congressional staff. And what's interesting is that two of the people who came into the meeting, one is a staffer for a representative out of the Northern Mariana Islands, one of the territories, one of the 7 territories, which needs to be treated as a state because it is effectively a state. These are Americans who live in Northern Mariana, Puerto Rico, all the other territories. This is Representative Sablan. His healthcare aide was in the meeting, as well as Seth Moulton. Seth Moulton, who is from Massachusetts, is a big public option supporter. And one of our stalwart One Payer States organizers, Bob Mason, has been hammering on Seth Moulton to take this argument seriously. And so we shifted our conversation in that meeting that we just had to make sure that we were inclusive of these different constituent members of Congress. So this is how we're going to win, is being smart about how we communicate. And then also we need to build out our alliances. We need to build out our constituency connections. So keep in mind that we've got a meeting coming up on December 9th. I don't know, Mike, if you can put a link in the chat on that one. We're doing a veterans-focused intergenerational justice summit that One Payer States is supporting, that is promoting. It'll be the 4th intergenerational summit that we've done over the last year, and it's going to focus on veterans issues. And veterans issues are particular, as you know. But what's interesting and what we've learned here is that only about 40% of veterans actually can access the VA system because of the complexities, the paperwork, and so forth. So veterans are not even fully served by the existing VA system. So we've got to figure out, how do we bring together a coalition that gets universal health care and the care that's needed to all of these particular communities and addressing their needs. So we're going to have a 2-hour meeting. We're going to listen intently to what veterans have to say, what their issues are. Why are veterans so important to winning this fight? Because when the veterans and their immediate family members make up roughly 15% of the population, 15% of the US population. And who do members of Congress listen to first? They listen first to business people. Secondly, they listen to veterans, and maybe in reverse, or maybe equally. But I'm saying that veterans are listened to. They have the ear of our members of Congress in a way that we typically do not. Even medical people, medical professional people, or academic nerds like me. What we have to do is bring them into the fight. And then in the spring, we're going to be doing another intergenerational summit focused on the communities that deal with disability rights and justice. That's the largest single constituency that's most adversely affected by our broken healthcare system, the disability community. Huge, huge numbers, huge numbers. Many of you know I'm blind in the left eye. I'm struggling with sight in my right eye. I don't talk about it a lot, but we have to tell our stories. We have to come out of the shadows and connect ourselves with the disabilities rights and justice community and continue building out. We need to do a better job with labor. But one of the ways that we build connection with labor is recognizing that many of them are veterans. Many of them are disabled. So we can bring labor in through other directions, if you know what I'm saying here, as well as business communities, right? Is that there are members in their family that are veterans and disabled. I mean, I'm just giving you a few examples of how we build out power, political power on the outside. We have to create a mass movement on the outside so that we coordinate the work that we're doing with our friends on the inside. And I'm a constant funnel for information for folks across the country. And I'll let you know what I'm hearing on Capitol Hill. And the fact that we have got to ramp up our education and our lobbying. And it's got to be done in a way that's very systematic, that's very strategic. And I'm going to stop right there and see if Charlie has anything to add, if folks have any questions. But I'm here to win. I'm in it to win it. I'm not here, frankly, I love the policy discussions, but at a certain point, I've got to pivot, roll up my sleeves, and get us victories, right? And we have to do this working together collaboratively. So I welcome everybody's conversation, and I'm going to drop my information in the box here. If your member is not on with the bill, please connect with me, and let's figure out a way to build out a constituency, a group of constituents in your congressional district to make sure that member comes onto the bill in the next 3 to 6 months. We've got time, but we don't have time. It's got to be urgent. So I want everybody to please contact me, cpennacchio@gmail.com, and I'll give you my phone number. You can text me, you can call me. I'm dedicated myself to this effort, and we just got to get this done. So I just want to let you know how much I appreciate you. And I want you, frankly, to appreciate me. You know, I mean, we have to love each other. This has got to be radical solidarity, and it's got to be very concentrated in terms of thinking about this work strategically. We've got to win. The consequences of not winning are too great, as you all know. So I'll stop there. Charlie, if you have anything, or if anybody has any comments or questions, you know how to reach me. Let's get this done. We're making great inroads here, and we just have to keep up the work. Mike?
Nothing really to add other than just to reinforce the importance of trying to get your representative on board with SBUHCA in a short time frame.
Yeah. I mean, you all know that Oregon and Washington are really close. They have universal healthcare commissions that are committed to getting this work done. Maine has a trigger bill in the state of Maine. Once SBUHCA passes, that implements they're forced to implement their universal healthcare, required by law to implement their universal healthcare system. So this is really critical legislation. So we've got Peter and then Jan, please. And thanks for hanging around for past the hour, folks. This is really important conversation. Thank you. Peter, Jan,
Chuck,
and
that was a nice kick-ass presentation, Chuck. Thank you for it. I had a couple of questions. One of them had to do with can you give us a capsule summary of how the SBUHC would differ from like the 1332 waivers under the Affordable Care Act, which are supposed to provide a way of dealing with a lot of the problems that the SBUHC addresses. And the second question is really the bulk of federal money coming into California at least goes to Medicaid, or Medi-Cal as we call it here. And by far the largest group of people who are getting those federal dollars are people on Medi-Cal. How much control are states capable of exercising over that money right now?
Really good questions. And I'm going to ask Charlie to come up, because Charlie, this is Charlie's sweet spot. It's in your wheelhouse, Charlie. Can you pick up those questions?
Yeah, so essentially, SBUHCA is an expansion of the 1332 waiver. It gives much more certainty to being able to include Medicare into a state program. There's ways that people think it could be done now, but it's extraordinarily uncertain, and we expect there would be court fights about it. With SBUHCA, it would eliminate that. The same thing is true with ERISA, which is essentially affects self-insured companies' plans. SBUHCA would give much more certainty to that. Again, there are workarounds that some people think could work. They would almost certainly be challenged in court if a state tried to do it. And SBUHCA would make it much more certain that they could actually do that, and that the waivers would be granted by CMS or the other secretaries that are involved in waiving the program. So essentially, it's a way to make it much more certain that states can do what they should be trying to do and eliminate court challenges to it when they do it. Yeah, that's the essence of it. It makes it much simpler for a state to do what it should do.
Is that good, Peter?
Yeah, I just want to ask also about Medicaid.
So Medicaid, the 1115 waiver that currently exists allows states to do a lot with Medicaid. But a state can't afford to pay providers the same rate for Medicaid patients as they get for private insured patients. With SBUHCA, you could create a system in which you didn't have to differentiate between what federal program would cover them. You could say the state program covers everybody, and everybody, a provider gets paid the same for everybody, and so there's no differentiation. So, yeah, the state can do a lot with 1115 waiver under Medicaid, but that's one of the things it can't do. It can't equalize payments.
Okay, Peter, thank you. Thank you for that. And I saw Betty jump up here. And congratulations to Betty and, working on getting Becca Balint, the US rep out of Vermont. And I'm just going to note that Becca Balint came out in the last 48 hours. And I don't know where people's politics are on this, but just to explain, I think, a real connection. She's the first Jewish American to come out in favor of a ceasefire in Gaza. Becca Balint, that's a huge thing. And I have to believe, and I'm going to believe, that we had something to do with sort of getting into her headspace and getting her to think more openly about the possibilities, right? In this case of getting it to single payer, as well as getting to peace, in the Middle East. And I do see an intersection of these issues in the work that we do. I hope that's acceptable to people. Sarah Weinberg, your hand is up. Thank you. You're muted, I think.
Yes, yes. Mine's just a funny question for you. So which state is going to be the Saskatchewan of the US?
I'm not into predicting. I mean, I can name 5 states that could be that, and I regularly just trip them off the top of my head, California, Oregon, Washington, maybe Minnesota, Maine, New York. I see them as, and I may be missing somebody in there, and Massachusetts has a terrific bill. And when you start listing them, you're bound to leave somebody out, but who knows? I mean, that's the thing about politics. You just never know. You never know where the stars are going to align. That's why we keep hammering away at every one of these critical states and beyond. It may come out of the South in a strange way. We're doing work in Georgia right now. And amazing, a Republican staff member responded to our outreach, and we had a face-to-face meeting with a very, very conservative Georgia Republican staff aide. And by the end of the meeting, we agreed that we were about 90% in agreement, 90%. And just thinking about this also, that Tom Price, I don't know if that name rings a bell. He was former HHS secretary under Trump. He was a former congressman from Georgia. He signed on a bill similar to this that Tammy Baldwin ran about 10 or 15 years ago. I say you just never know, but if you adjust your arguments and you listen intently to what their concerns are, and you find that common ground, you stay focused on that common ground, that's how you win ultimately. So I don't want to predict any one state over another, but I appreciate the question anyway, Sarah. But you're the other point that you're making there, though, is something that members of the staff, very young, healthcare staff on Capitol Hill are very young by and large. They're all relatively new. Many of them don't have any background in healthcare, and they really appreciate my coming by just to have these conversations. Even they want to learn. And what's interesting is that almost none of them are aware of the Canadian model of how Canada got to national Medicare through Saskatchewan. So that's a really good reminder that we have to keep telling ourselves. And that's also our history, right? US history is riddled with examples in terms of voting rights, civil rights, child labor. It started at the state level. The progressive era started in Milwaukee, went to Wisconsin, went national. Same thing with the New Deal. It was modeled in Albany, New York, before FDR took it to the national level. So this is our history, and this is, I believe, how we're going to get there. Thank you so much. Stay in touch, please. Let me know. I'm here. I am your resource. Mike will tell you that much as he may be concerned about me firing him, Mike, he's also concerned about me doubling my salary, which is also nothing. We're an all volunteer organization. We're all in this fight together, and we're going to win it together just by being, again, being strategic and by applying our resources. Oh, and the other thing to make mention, Mike, is the national petition. We've just joined arms with Social Security Works. This is an organization with 4 million members on their listserv. And they provide us an opening to numerous other organizations like Move On and Public Citizen, and the list goes on and on and on. we have a chance in the next few months to expand our numbers dramatically in support of SBUHCA. So we're not just spitting or blowing in the wind here. We are building a dynamic, powerful movement, and this petition campaign is really has the potential to really break us out into a real powerful organization that will be able to, again, educate and lobby for success over the next 2 to 3 years. And I'm going to just share one final story, and that is that when I began union organizing at my university, 3 years out before we won, only one other faculty member, and he was an adjunct. I was a contract full-time employee. We joined arms and reached out to the American Federation of Teachers, and they brought a campaign into Philadelphia. And over 3 years, I would talk to my colleagues and they said, Chuck, it'll never happen. It'll never happen. You'll never get a union here. It'll never happen. Never, never. Well, we won that union vote 3 years later, 255-2. So don't tell me we can't do what we're going to do. That's a lesson I think many of us need to remind ourselves of, is that the impossible takes just a little bit longer. That's what we're going to do. Thank you.
The petition is in the chat. You can take a look. At least the one payer states version of it. The Social Security Works version will be slightly different, but you get the idea from the one that you'll see on the in the chat.
Right. And we'll be spending, Mike, the next several weeks building out our organization support and endorsement for this national petition. And we'll launch it, in early January. Is that the timeline?
Right.
So, keep any organization that you are a member of or have any voice in, funnel that to Mike and or myself, but mchuntington@gmail.com, and let us know that your organization wants to endorse this petition, and then they can become an endorser, and their logo will be listed or will be emblazoned on the bottom of the petition. So this is how we're building out on that other track, and also social media. We've got Simon Hutton is ramping up our social media, and we have a brand new website that's going to be coming out next week, right, Mike?
Yep.
So many things are happening. Thank you. And well, I just want to, before folks peel off, I just want to wish you everybody a warm and wonderful Thanksgiving. Elaine, in Fort Collins, Colorado. Hey, Elaine.
Yeah, I received a letter from Ro Khanna today, and it was really good. And I don't know how to get it into the chat, but it's not that long, and I would encourage people to send it to their networks.
What is it exactly?
It is telling about his bill, and I believe the petition is on there too.
Did it come
Or
by
a
email?
petition, yes.
Can you forward it? In case for some reason I didn't get it. I mean, I usually get everything, and Mike as well. Yeah, just forward that, and then we'll push it out. Thank you for that. Heads up.
Yep.
We are eyes and ears for each other. Thank you, Elaine. Mike, you want to wrap it up unless folks have anything else?
Yeah, this has been a wonderful third Friday meeting. Thanks, Chuck, for all that work that you've been doing. And I think all three of the speakers today, we need to bring back for more questions and answers. So any other questions before we sign off? Well, thanks again, everybody.
And I mean, if you're able also to contribute, if you're not already doing so, just a few dollars a month is going to get us a long way. There's no more bang for the buck contribution that you can make that'll go further than what we're doing here in DC. So thank you, everyone. And again, have a great and terrific, wonderful Thanksgiving. Love to you all.